Hi there, I'm Frank.
Hi, I'm Leandra. I'm going to be your student therapist today. So I want you to have a seat and get comfortable. Okay. So before we start, I want you to understand that this is a safe place for you to talk about whatever it is that you came here for. But I did want to start off by letting you know that there are certain things that would cause me to breach our confidentiality. Everything you say here is safe and it stays between us until we have certain circumstances. If you share with me that there's a threat that you would harm yourself or others, if there's an instance of sexual abuse or physical abuse or emotional abuse towards a minor, a child, or the elderly, I would be forced to report that. So I want to make sure that you understand that before we get started.
Okay.
Okay. All right. So, um, tell me more about yourself. What brings you in here today?
Well, I just had a lot of concerns just about my health in general. Like, I just have this overwhelming feeling that I have a carcinoma on my colon. And I know that just sounds really bizarre, but it's just, I've always been really anxious about my health, and I've just always been really anxious about obtaining like a new disease just because there's so many diseases out there, and the news doesn't help me because I just see so many things of like Zika outbreak and just all of these crazy things that could happen, things that are in your water. And so um, I guess it didn't really help when they literally like found like it was more like a little lump like on my heart, and that was when I was like 13.
Okay.
And they said that it was nothing, there was nothing serious, but ever since then, I think that's probably when all of this really started. And I did graduate from medical school, and the fact that we were learning about so many diseases there really brought that to my awareness. And then all of like my colleagues would like joke about it, like, oh, we might have this and we might have that, and I'm sitting there like, I might have that, or I could get that. And it freaks me out. And I mean, I didn't even really choose to come here. I was sort of just referred here because my doctor was pretty much like done with it.
Okay. So do you mind if I take a couple of notes?
Sure. Yeah.
Okay, so basically you're here, you feel like you have a carcinoma on your colon.
Mhm.
All right, when was the last time you went to the doctor?
Well, I spent 10 days at this diagnostic center that I was referred to, and it was really like this place where I could get everything done, like colonoscopy, like the works, and they found absolutely nothing at all. And clearly you can see that I'm not happy about it, just because I still feel like something's there. Like, what if they missed something? You know, I always like check, like to see if there's like any masses or anything like that, and I can't help it. It's
Okay.
just, it happens.
So you check to see if there's any masses. Tell me more about that. What exactly do you do when you're checking?
I'll just, grab at, where like my colon is, and just really, like squeeze there and give myself like the little assessment to see if, there's like a lump there. And, just because I feel like I could feel the lump. I feel like if I checked, I could feel the lump.
Okay. And you've been doing that for a while now?
Yeah.
How long? How is that?
I would say it's been for a while, probably for a couple of months, maybe every day. Just once a day, maybe like once in the morning. Actually, that's a lie, twice. Because now that I'm thinking about it, I do it in the morning and I do it at night. And I'll just do it when nobody's watching. Sometimes even in my own office, I'll just use like the x-ray machines to like see if there's anything wrong, because I mean, I have that access, it's my office.
Okay. So you're checking at home and you're checking at work?
Yeah.
Okay. So
So I guess maybe I check, sometimes it'll be 3 times a day if I'm feeling really anxious.
okay. So that's anxious feeling. Can you tell me more about that? What exactly, when you say you're feeling anxious, what does that feel like to you?
It's just like this overwhelming sense of like fear, and
Yeah.
it's like this dread, so to speak, like, and it creeps on me. It creeps, like it just, the best way I guess I can describe it is like if you're warm, then it's like, I feel like part of my face getting cold, and like the rest of my body just follows in suit, and like sometimes I'll just feel certain twinges of pain like in my abdomen, which is like the whole point as to why I'm scared that I'm getting something or that I can get something, because your abdomen's not supposed to hurt. And so it's like, no doctor can tell me what it is, and it's really frustrating because I feel like they're kind of idiots. I mean, that's a horrible thing to say, but as a, medical doctor, I feel like they're not doing their job. They're not really, they're not finding what they're supposed to find. There's supposed to be something there. This pain doesn't just come from nowhere. Like, I'm not crazy, and I'm not exaggerating it.
You sound a little aggravated towards them too.
A little bit, yeah.
For not being able to tell you what it is, and you haven't been able to figure out what it is yourself either.
No.
Well, I want you to tell me a little bit more about your medical history. I know you told me about when you were 13 and they found a small lump on your heart. Is there anything else that you've been going through or have gone through in the past medically?
Well, I mean, I've had just little things, but little things that, I mean, anybody's really been through before. I mean, like, besides that lump, I mean, I've broken my arm once when, I had like a cyst like on my arm when I was 4, and they removed it, and just little things like that. But I think that moment with the lump, that scared me the most. I mean, I was only 13 years old, and my parents weren't being especially helpful, It was just one of those things that it was like, oh, the doctor, they're gonna fix it. And I'm like, looking at them like, no, Mom, like, we learned that like the heart is like our beating center, and if there's something that can mess with my heart, I'm gonna die. Like,
That's gotta be a lot of pressure and a lot of fear for a 13-year-old to have to go through such medical experience.
yeah, I was not having it. I was like, you've gotta be kidding me. So I think that really, really hurt me the most. And I mean, I'm not taking any like medications or anything for this.
Are you taking any other medications for something else?
Just anxiety, like maybe sometimes I'll take like a Xanax or something, but like.
Just sometimes? How often is sometimes?
Maybe like twice a week.
Twice a week?
Yeah.
What is the dosages that you take?
Probably maybe like 10, 20 milligrams.
Okay. So pretty mild, just about twice a week.
Pretty much, just so that way like the overwhelming feeling can stop, and just like those pains, they tend to go away once I take a Xanax, so that makes me feel really good. But I don't feel like I have like a dependence or anything like that. It's something that takes the edge off, so to speak.
Okay, so I do want to ask you something. So
Okay.
We'll say that the turning point is when you were 13.
Okay.
So before you were 13 versus after you were 13, did you see any changes in your worry level about this, getting sick and things like that? Would you say it was greater or less or more intense, less intense? How would you describe? Or did you notice a change from before you were 13 going through that medical issue at the age of 13 and then afterwards? Would you say there was any change, or have you just always felt like you were worried or preoccupied about your health? You're a doctor, so I know you definitely do care about health.
Yeah, I would say if like I could rate it, because that's the best way I could picture it, I would rate my anxiety levels as like a 9. And like when I was a child, I was a child. I didn't even know I wanted to be a doctor back then.
Okay.
Come to think about it, I think maybe just my experience of my heart condition that I had maybe sort of influenced why I wanted to be a doctor. Because before then, I didn't know what I wanted to do. So I guess now that I think about it, maybe that is what influenced me to be a doctor, and to like, to learn more about what's out there and to how to treat it, just in case anything like that ever happens to me again. Just because I feel like it could happen again, and that's just like, sometimes I can't even sleep over it.
Well, I would say on the bright side of that, instead of letting that medical emergency really kind of hinder you into the worry, you did make something very positive out of it. You know, you got dedicated to school and your practice and you became a doctor. That's not a normal thing that many people can do. So, you know, you were able to take that fear and take that anxiety and then turn it into something great. So you definitely have the potential to, you know, do well and kind of conquer whatever it is that's been bothering you. So apart from, you know, the heart issues and checking your colon, you do that probably about maybe at the most 3 times a day. And
Yeah, somewhere in that range.
when
Yeah.
did the stomach pain start?
That's a really good question. I guess the stomach pains have been happening maybe for a couple of years now. At first, maybe like the first year that I had the stomach pains, I was like, oh, you know, whatever, you know, gas or whatever, bloating. But I think the more, you know, it continued over maybe like the course of like the second year, I was like, this isn't good. I started having those like, I like calling them like anxious attacks. I know that they're panic attacks, but I don't think they're that severe. Like, I don't start, you know, I don't like choke up or anything. It's just that dread and then the pains and the twinges. Sometimes I feel like if I just grab at it, it stops. I just don't think that's normal.
Okay. Can you tell me about a time when you did begin to feel that pain in your stomach or your abdomen? What were you doing, and then like how did it come on? Was it sudden, or just kind of give me a picture of, just tell me a story about, if you can remember, probably maybe the last time or one of the times that you've had one of these anxious attacks.
Yeah, I remember I took my kid to like the fair, and I just remembered that we were just like walking around, and like he was like eating a corn dog or something, and I was sort of thinking about what I wanted to eat, but the fact that like I kept seeing so many like junk food options, and then, you know, reading about like, you know, like hot dogs are good for you, and then it's just like walking with him and watching him eat the corn dog, so to speak, then it's just like, I remember one time it was just very sudden, and like, I guess it triggered me, so to speak, to like really start freaking out about, you know, what my kid is eating and what type of food is out there, and the fact that there's like no options for me anywhere. I'm pretty much a health nut. Like, I will go around and look for like any supplements that like enhance your health, and like, you know, just from like the little, I guess doctors' offices, they'll have sometimes like a little station for supplements, and like, just cause I know my friend does that in his practice, and I would always try to get like a whole bunch of supplements for like Fiber Plus and like, you know, GlutaShield, you know, for like my intestinal tract. I mean, I haven't really taken any supplements lately. Maybe just some GlutaShield, which is supposed to help like with your gastrointestinal tract, but
How often do you take that?
maybe just once a week.
Okay.
I guess just once a week. I mean, it's not really a medication. It's just like a supplement that, you know, they have. You know, anything that I could take to be like pro-health, like health conscious, like I'll just do it. Like, I'm a salad eater. I really try to stay away from a lot of meat because of how it's like processed, and I try to stay away from just a lot of too much dairy, and just stay away from too much coffee, and yeah, because the possibilities of getting something are just endless.
Yeah, that is true. There's a lot of things out there. It seems like you're being very proactive about trying to lessen the chance of you having it.
I have to. I mean, my wife needs me. My kid needs me.
Before we, I do wanna hear more about your wife and kids, but right before that, I just wanna ask you one more thing about, you know, you told me that you have these anxious attacks that you call them.
Yeah.
About maybe, we'll say like, how often are you getting the anxious attacks at this point?
At this point, I would say, I know it sounds really vague, I'm sorry, but it's like once or twice, maybe every couple of days, so sometimes it's just it's more like sporadic. It's not, you know, that's why to me it's not normal. Like, it's one of those things that it's like, it could be like Monday